Hi, I'm Dr. Allen from Jones Animal Hospital. Welcome to Vet Visits. Today we're going to talk about something that's a little bit different. It's seizure disorders. And seizure disorders are fairly common in dogs. We see them in cats occasionally, but much less often than we see them in dogs. The most common seizure disorder we see is epilepsy. Epilepsy virtually always shows up before 5 years of age. So if your dog's less than 5 years of age and begins to have seizures, the odds are very high it has epilepsy. Maybe we should talk a little bit first, though, about what does a seizure look like in a dog. It can look like a lot of different things. The most common image is a dog that's laying on its side. Often they'll be arching back with their head, paddling with all four legs. Very often they'll lose control of their bowels or their bladder. Very often they're chomping with their mouth. It'll last anywhere from a few seconds to several minutes. And it can look very frightening when it's going on. There's nothing for you to do with a dog having a seizure. They cannot swallow their tongue as long as they're not on the edge of a pool or a body of water where they might fall in and drown or fall down some stairs. As long as they're in a safe place, the best thing is just to keep things quiet. The less stimulation, the better. Keep them safe. And just let them get over it. Very often within just a few seconds or a few minutes, they'll stop the seizuring, and then very often within a couple more minutes they're acting like nothing ever happened. And that's what's called a grand mal seizure, and that's the most common seizure we see with pets that are epileptic. Other presentations of seizure, those can be kind of odd. There's a type of seizure called fly catching, where you see a dog that'll just be standing there, they'll kind of get a faraway look in their eyes, then they'll start snapping. And they'll snap it looking like they're snapping at flies, but there's nothing going on. And that too is a type of seizure disorder. I've seen dogs that would seem like they were attacking their feet, and it sounds like a dog fight. And that's a really odd, frightening thing to see. And that's another form of seizure disorder. So seizure disorders can take on many different looks. Again, if it starts at less than 5 years of age, it's almost always epilepsy, which is a disease where the brain is hypersensitive, that individual has a lowered seizure threshold where it will begin having seizures, sometimes for little or no reason. Those often can be very well controlled with medication. Most of the time with just a single medicine, although sometimes we have to use combinations of medicine to control them, but they can often be controlled very well. It's usually a lifetime medication. It tends not to shorten their lifespans. I've had lots of patients that turned epileptic by a year of age, and then I would see them for the entire rest of their life, and they went on to live a normal, complete lifespan. Just as long as they took their anti-seizure medicine, they were fine. Seizures that begin at a later age, though, older than 5 years of age, are almost always something other than epilepsy and are, in many cases, very difficult to diagnose. Occasionally it'll be organ problems, liver, kidney disease causing toxins to build up. Sometimes it'll be things like lead poisoning, which can certainly cause seizures if they've had chronic exposure to lead, like from lead-based paints in older homes. Occasionally, if they've gotten into something poisonous, antifreeze, snail bait, things like that can cause seizures. That's usually kind of a short-term thing because those often don't make it. There are many different brain disorders that can also cause seizures. Tumors or cancer in the brain. There are several different inflammatory problems that we'll see in the brain, and there are some infectious problems. Dogs can get encephalitis just like anything else can. Those types of things often require very advanced diagnostic work to diagnose, and there are very few private practices that are equipped to diagnose those type of things. They often need cerebral spinal fluid analysis, CAT scans or MRIs of the brain, sometimes even brain biopsies before you can have a definitive diagnosis of those types of problems. So usually if a dog is older than 5 years of age with a seizure disorder, if we're trying to get to the bottom of it, and if the client is willing and able, we wind up referring them to a veterinary neurologist. And that's usually at one of the teaching institutions. And from where we are, we typically send them either down to UT at Knoxville or up to Blacksburg to Virginia Tech, where they can have veterinary neurologists to work them up and then get them on, hopefully, medications to help control the seizures. Short of that, They can often be controlled with the normal anti-seizure medicine, but typically the prognosis is not nearly as good as a pet that has epilepsy that is just going to be well managed on those types of seizure medicines. People often ask about cannabinoids, CBD oil and things like that to control seizures. And there's a lot of stuff in the lay literature about that. We as a veterinary profession don't have much experience with that yet. There's some research being done at Colorado State University right now, but that's still pending. And we really are ill-equipped to prescribe medications that we don't have research behind to prove that they're safe and to prove that they have efficacy, which means that they're effective for what we're giving them for. So it's not that we don't know about some of these things, it's we don't have enough evidence to feel like we can confidently prescribe some of those medications. Like I said, a lot of stuff on the internet, a lot of stuff in the common literature, but very little actual research has been done on some of those things. So if your dog has seizures or your cat has seizures, have your veterinarian to work it up. Hopefully it'll be something that can be controlled. If it's something that's in an older patient, though, very often it's very difficult to diagnose and may require referral to a veterinary neurologist in order to get to the bottom of it and find the most appropriate care. I'm Dr. Allen at Jones Animal Hospital. Thanks for joining us today on Vet Visits.